Dr. N.K. Arora is Chief National Technical Advisory Group on Immunization. NTAGI, appreciate your joining us, Dr. Arora. The government has just announced that they want states to test all positive samples for genome sequencing. Is there a fear of new mutants out there, new variants of COVID that perhaps could be a cause for concern? Sir, you're on mute. Sir, you're on mute. Dr. Arora, you're on mute.
Thank you very much, Rajdeep. Thank you very much for inviting me. I would start with saying clearly that we should not panic. In fact, we are the things are in place. The community is very well protected with very effective vaccines. Plus, most of us have suffered some kind of natural infection. So this hybrid immunity has been extremely good. And as a result, Omicron wave, India kind of faced it very well. We did not have too many admissions or deaths throughout, although in March, April, we had some 400,000 or 300,000 cases a day for a few days. But now, as you very rightly said, it has come to almost the lowest since 2020. The important point and the critical issue is that surveillance, genomic surveillance is the key at this time, and that has been the philosophy throughout this 22, that we should monitor. And the comforting point is that whatever subvariants are circulating anywhere in the world, they are also picked up in the country. And the Indians have kind of not suffered with severe disease or death because of any of these. Now the question is that we need to continue with the same vigil, whether it is individuals with mild symptoms, those who are hospitalized, or even switch surveillance, so that in case any new variant comes, which can cause severe disease or a more virulent form, we should be immediately able to pick it up. And I think system is very much in place that we should be able to do it. So coming back, that there is no need to panic.
You're saying, Dr. Arora, there is no need to panic. The reason, of course, that there was some concern is we are told the health minister has now called a review meeting on Wednesday, and states have been directed to step up genome sequencing. I know you're saying it's part of a pattern, but is there any reason for us to believe that there is a new strategy being put in place, or the manner in which genome sequencing will now take place is any different to what you've done across the year?
No, in fact, I am associated with the INSACOG Genomic Surveillance Group, and we have continuously, because in fact, right in March, April, this decision was taking that as the variants circulating are not causing the virulence as we saw it last year, but this is the time to see that our surveillance is very tight, it is very efficient, and in fact, now there is a dashboard. You can see week to week what changes are there. An important thing is that some of the variants, for example, BA4, BA5, which caused a lot of severe disease and death in North America and Europe, they were not able to spread. They were just 5–10% maximum. At the moment, most of it is BXX, which is a recombinant virus, plus there is another virus by B275 and its subvariant. So the question I'm saying is that we are well on top of the situation. Things are being done, and there will be additional efforts. We are going to have the meeting tomorrow, and we will see. But
so there are no new variants out there, Dr. Arora? No new variants that we have to be concerned about, because lots of people are going to have holiday travel over the next couple of weeks. You're telling people it is safe to be out there. There is no real cause for alarm. Am I right?
So what is also being done, and I think that needs to be further strengthened. The point which you are trying to ask is that those who are having international travel, those who are coming in, they should be tested, and that issue needs to be strengthened. And from wherever they are coming, it doesn't matter whether they are coming from East Asia, Southeast Asia, or any other part. Anybody who is coming from outside is to be kind of sampled and see, because mutants can travel, the virus does not see any boundaries. So it can travel from any way, and that is the one which is to be strengthened. Our current system is very good, and maybe the number of samples we will start picking may further increase.
Because, you know, we've seen, of course, the surge in China, but we are also seeing more cases being reported in other parts of the world, from the United States to Japan. This was around the time last year, sir, when Omicron hit large parts of the world. India, as you said, was relatively insulated from the from Omicron's more contagious elements. But are we seeing, therefore, a return of a potential variant like Omicron as we end the year?
It's almost like asking an astrologer. It's very difficult to say whether a new variant will emerge out of not or. I mean, if the variants can emerge any time, but very difficult to say whether it is likely. The reason it appears in China, the kind of this wave we are seeing, is because most of the Chinese were so much contained during last 2.5 years that natural infection had not occurred. Their vaccine issues have also been raised. But in contrast, India had both very high level of natural infection and very high level of coverage, and that has really prevented us and protected us from Omicron onslaught.
Okay. Dr. Arora, you're giving, in a sense, a message of reassurance, telling people not to panic, and claiming that even the extra surveillance and the possibility of more genome sequencing does not necessarily lead anyone to have to be alarmist about the situation in India. I appreciate.
I will just add one.
Yes, please.
I will just add one sentence, and that is, in case there is anything, we will share it with everybody, so that the preparedness of the country is so good that we need not be kind of afraid. We are well prepared, and if there is something new, I think the Indians will know it quickly.
Thank you very much, Dr. Arora. Message of reassurance coming from you matters. Thank you so much.